wanted to talk a little bit about my approach to the spine. Number one, I'm board certified in primary care sports medicine. One of the things that differentiates me is what we call non-operative orthopedics. So I'm not going to do any surgery on the spine. I take it another step, I'd say. A lot of my colleagues in the non-operative orthopedic space, at least for spine care, will do epidural injections of steroids. My approach is taking more of a root cause approach, and so I prefer to use regenerative medicine. We can bring some healing and repair. So for example, and I'd like to talk more about specific issues, but say you're dealing with some lumbar disc spine pain, and there's an x-ray or an MRI that shows some degenerative joint disease, degenerative disc disease. And so a common approach will be to find that level where there is degenerative disease and then do an epidural injection of steroid at that disc base. The benefit of a steroid would be to decrease some inflammation and to decrease pain. Steroid will provide, it's almost like giving ibuprofen to that area around the clock for somewhere about 3 months, maybe less, maybe a little bit more. My approach would be to put some regenerative therapy in there rather than the steroid, so that we can bring some healing and repair to that area rather than just providing that short-term pain relief. The benefit is that not only do you get repair and healing in there, but you also get some pain relief. It might not be quite as quick, but eventually it'll start feeling better, and you have the added benefit of having that area now be a little bit more repaired, and in the long run that's going to help you from the pain coming back again and the pain in that area from ultimately worsening. For example, one of the regenerative therapies, we've talked about this before, is platelet-rich plasma injections, PRP. And say once again you have lumbar degenerative disc disease. We would do an evaluation and determine that we feel like the pain is coming from the degenerative disc in your spine. My approach would then be to use PRP and put the injections into the joints of the spine and bring some healing and repair in there using PRP. Now, this is my ultrasound machine. The benefit, it's almost necessary if there's going to be any degree of spinal injection therapy to do it with imaging guidance. I prefer the use of ultrasound because I am able to see my needle placement the entire time, and it gives me also real-time information on the vessels in there, and I can do this treatment right here in the office. The other benefit of PRP is that I can treat multiple areas at the same time. So a typical approach would be to treat the facets on both sides. I can treat the nerve roots, can even treat the sacroiliac joints. So we have a lot of versatility with PRP, and it's great because once again, we're providing a root cause and regenerative treatment and not just a Band-Aid solution.